everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. I have already started with the lower limb session. Our today's topic is knee joint. It is a very important topic for the university exam. It comes for 10 marks as an LAQ. So let's begin with the introduction. It is the largest and the most complex joint of the body. The complexity is the result of fusion of three joints in one. It is called as complex joint because it consists of three joints like lateral femorotibial joint, medial femorotibial joint and femoropatellar joint. The joint between the femur and the tibia laterally also, and there is a medially also, and it has also joined with femur and patella. So the joint between the femur and the tibia are of condylar type, and the joint between the femur and the patella are of saddle type. So it is a condylar synovial joint between the two condyles of femur and patella, femur and tibia, and one saddle joint between the femur and patella. Articular surfaces, it is formed by condyles of the femur, patella, and condyles of the tibia. Femoral condyles articulate with the tibial condyles below and behind and with patella in the front. It consists of 11 ligaments: fibrous capsule, ligamentum patellae, tibial collateral ligament, also called as medial ligament, fibular collateral ligament, also called as lateral ligament, oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, and as well as transverse. We will be seeing this ligament one by one. Fibrous capsule, it is a thin and deficient anteriorly, where it is replaced by quadriceps femoris, patella, and ligamentum patellae. It consists of two constant gaps, that is, two openings in the fibrous capsule. One is for the suprapatellar bursa, and second is for the exit of tendon of popliteus. Second is ligamentum patellae. It is 7.5 cm long and 2.5 cm broad. Above, it is attached to the margins and the rough posterior surface of apex of patella. Below, it is smooth and attached to the upper part of tibial tuberosity. Tibial collateral or medial ligament, long band of great strength. Superiorly, it is attached to medial epicondyle of femur, just below the adductor tubercle. Anterior part, inferiorly, it is divided into anterior and posterior part. Anterior part of the superficial part, which is 10 cm long and 1.25 cm broad, separated from the capsule by one or two bursa, and posterior part is deep, that is short and blends with the capsule with medial meniscus. Fourth is fibular collateral or lateral ligament. It is strong and cord-like. This was a long band-like tibial collateral. Fibular collateral is strong cord-like. It is 5 cm long. Superiorly, it is attached to the lateral condyle below the popliteal floor. Tibial collateral ligament is attached to the medial epicondyle of femur, and this is attached to the lateral epicondyle of femur. It is below the adductor tubercle, and this is below the popliteal. Inferiorly, it is impressed by the tendon of biceps femoris and attached to the head of fibula in front of its apex. Fifth is oblique popliteal ligament. It is an expansion from the tendon of semimembranosus. Arcuate popliteal ligament. It is a posterior expansion from the short lateral ligament. Seventh is anterior cruciate ligament. It begins from the anterior part of intercondylar area of the tibia, runs upwards, backwards, and laterally. It is attached to the posterior part of medial surface of lateral condyle of the femur. Eight is posterior cruciate ligament. Begins from the posterior part of intercondylar area of the tibia, runs upwards, forwards, and medially. Attached to the anterior part of lateral surface of the medial condyle of the femur. Anterior cruciate ligament begins from the anterior part. Posterior begins from the posterior part of intercondylar area. Both begins from the intercondylar area of tibia only. It runs upwards, backwards, and laterally. It runs upwards, but forward and medial. It is attached to the posterior part of medial surface of lateral condyle of femur, and it is attached to the anterior part of lateral surface of medial condyle of femur. Ninth is medial meniscus. It is semicircular, begin wider behind than in front. Its peripheral margin is adherent to the deep part of tibial collateral ligament. Posterior fibers are attached to the transverse ligament. Lateral meniscus. This is circular, posterior, and is attached to the medial condyle of the femur through two meniscofemoral ligaments. Last is transverse ligament. It connects the anterior end of lateral and medial meniscus. Synovial membrane. Synovial membrane of the knee joint lines the capsule except posteriorly, where it is reflected forward by the cruciate ligament, forming a common covering for both the ligaments. Bursa around the knee joint, anterior, lateral, and medial bursas are there. So in anterior bursa, it includes subcutaneous prepatellar bursa, subcutaneous infrapatellar bursa, deep infrapatellar bursa, and suprapatellar bursa. Subcutaneous prepatellar and infrapatellar, deep infrapatellar only, and suprapatellar. Lateral, it has a bursa deep to lateral head of gastrocnemius. A bursa between the fibular collateral ligament and biceps femoris, a bursa between the fibular collateral ligament and tendon of popliteus, a bursa between the tendon of popliteus and lateral condyle of tibia. Medial bursa, a bursa deep to the medial head of gastrocnemius, and serine bursa, a bursa deep to tibial collateral ligament, a bursa deep to the semimembranous. Now we will see relations one by one. Anteriorly, there is anterior bursa, ligamentum patellae, and patellar plexus of nerve. As in the diagrams, we can see the different types of ligaments. Fibular collateral ligament, this one. Superior, superficial and deep parts of tibial collateral ligament. These are the superficial and deep parts of tibial collateral ligament. This is the capsular ligament. This pink one is the synovial membrane. This is medial meniscus, lateral meniscus, and these are semitendinosus, gracilis, sartorius, inferior medial vascular nerves and vessels. Here we can see ligamentum patellae, transverse ligament, posterior cruciate ligament, lateral meniscus, coronary ligament, anterior cruciate ligament, and oblique popliteal ligament, medial head of gastrocnemius, common peroneal nerve, biceps femoris, plantaris, fibular collateral ligament, anterior cruciate ligament. These are the different types of ligament which is seen in the diagram. For example, we have to draw these two diagrams. Posteriorly, at the middle, we have popliteal vessels and tibial nerve. Posterolaterally, there is lateral head of gastrocnemius, plantaris, and common peroneal nerve. We can see lateral head of gastrocnemius, plantaris, and common peroneal nerve. Posterior-medially, medial head of gastrocnemius, semitendinosus, semimembranosus, gracilis, popliteus as its insertion. So, medial head of gastrocnemius, sartorius, semitendinosus, gracilis, and popliteus as its insertion. Medially, there is sartorius, gracilis. Medially, we have sartorius, gracilis, semitendinosus, great saphenous vein with saphenous nerve and semimembranosus. Sartorius, gracilis, semitendinosus, semimembranosus. Laterally, biceps femoris, tendon of origin of popliteus. Blood supply. It has 5 genicular branches of popliteal artery. It is supplied by 5 genicular branches of popliteal artery. Descending genicular branch of the femoral artery also. Descending genicular branch of lateral circumflex femoral artery. 2 recurrent branches of anterior tibial artery. Circumflex fibular branch of posterior tibial artery. Nerve supply. Femoral nerve through its branches to vastae, especially the vastus medialis. Sciatic nerve through the genicular branches of tibial and common peroneal nerve. Obturator nerve through its posterior division. Now let's talk about the movements of the knee joint. It has extension, locking, unlocking of the knee joint, flexion, medial rotation of flexed leg, lateral rotation of flexed leg. Extension is through quadriceps femoris. Locking of the knee joint occurs through vastus medialis. Unlocking occurs through the popliteus muscle. Flexion occurs through the biceps femoris, semitendinosus, semimembranous muscle.
medial